All right, everybody, we're going to start now with our session 3, increasing public engagement with NASA data. So as Tracy mentioned earlier, these are going to be tag team talks between our HAQAST members and our stakeholders. So we're going to first start off with Arlene Fiore of MIT and Adeyeye of the New York State Department of Health. And Arlene, I think you've been a member of HAQAST since 2016 now? Well, back with HAQAST, so Eva, I knew we'd been together for a long time. So Arlene has been just a foundational part of our team for many years, and I also want to thank her. She hosted at MIT our last semi-annual meeting of technical interchange meeting that we have every 6 months, and it was the biggest attendance ever at a HAQAST meeting. I think over 350 people online and in person. So it was a really awesome way to go out before our showcase. So thank you, Arlene. Come up here.
Thank you. Thank you so much, John, Tracy, everyone. It has been an absolute privilege to get to be part of this team. I can figure out, there we go. And to have the opportunity to work with such a fantastic group of scientists, researchers, and stakeholders in both the air quality and the health community. And I do not have time to individually thank everybody, but so my slide is an attempt to do that. But some of you are in the room and many are not. I'm going to focus today, we're going to have kind of two parts, two thrusts to our work. And I'm going to jump right into the first. So in order to understand this challenge for air quality management, the first thing that we have to recognize is that ground level ozone, one of our top two with fine particles that we've already heard a lot about today, being the other one in terms of challenges to attain air quality standards, ozone is not emitted directly, but instead forms through a complex set of atmospheric chemical reactions that involve reactive carbon precursors, or these VOCs, and nitrogen oxides, and in the presence of sunlight, those form ozone. And so the challenge that air quality managers, particularly in urban airsheds, face is how do we reduce ozone? Which of these precursor species is going to give us the most effective approach to reducing ozone? And importantly, these sources are both natural or biogenic and therefore not controllable, as well as sources that are under control. And so understanding this situation at the local scale is quite complicated. And so we now, for I believe 3 decades, have had satellite instruments in space that have been sending back information about this formaldehyde and nitrogen dioxide that we've already heard about today. But formaldehyde is a nice proxy for the amount of reactive carbon that is reacting and going on to form ozone. And NO2, of course, is part of NOx. And so we're building here on a history of using formaldehyde and NO2 to learn about the chemistry that's forming ozone locally. But the question that we were really interested in understanding as part of our project was, how do the conditions change on the days when ozone levels are highest, which is of most relevance to attaining air quality standards and, of course, exposing people to high levels of pollution. And so I can advance my slide. There we go. What I'm showing you here is we were very interested to understand what information we can pull from these satellite products. And in 2017, there was this Tropomi instrument that was launched that gave us our finest spatial resolution yet. Of course, we now have even finer possible from TEMPO, and we'll get there in the next slide. But what you're looking at is a compositing exercise that my graduate student did, where she said, okay, what if I have 19 sort of medium or low ozone days in contrast to 19 high ozone days in this kind of New York City metropolitan area? What's happening to formaldehyde? Why is this not advancing? There we go. It's just slow. We have more formaldehyde but also more NO2 on the highest ozone days. And this ratio is kind of an indicator of whether your chemistry is such that you expect to have a stronger response to controlling NOx. And so the big takeaway here was that on the highest ozone days, we expect wider areas of the region to be more sensitive to controls on NOx. And through HAQAST, we were, I'm not sure why. There we go. Working with Michael Geigert, who will be speaking shortly, but this Qiao et al. Paper was led by my graduate student. After it was published, we ended up in conversations with the State Air Agency of Connecticut, and we ended up tailoring a version of a figure from her paper for them to use in their state implementation plan to help their whole process of planning for attaining air quality standards. And I have a quote here from a collaborator who couldn't be here today at the Northeast States for Coordinated Air Use Management. And I just also wanted to point out that on this color bar, you'll notice that in the bottom row, there's this area right around the urban core of New York City where you're seeing colors and kind of blues and greens. And those are places where this nonlinear complicated chemistry may be such that there could be some added benefit from VOC control. We kind of know that if we reduce NOx enough, we're going to eventually bring ozone down, but there's this sort of in-between place where some VOC control could be helpful, but we actually need a clearer understanding of exactly what is going on in that region. And so far, we have been working with this once-a-day overpass information from Tropomi. Which is what you're looking at the static image of tropospheric column NO2 here. And what we now get from Tempo is this view throughout the daylight hours. However, one of the earlier talks already pointed out the need to understand column, which is what you're seeing from space, versus what's going on in surface air. And so now we really need to understand how those relationships change by time of day. So I just wanted to highlight a paper and review that I think of as anticipating Tempo, where we've been working with our stakeholder partners and thinking about what are the diurnal cycles in surface NO2 and formaldehyde versus the column using ground-based measurements to kind of get ready for Tempo. So I want to switch gears and talk about a challenge in the health community that actually I was nicely set up for earlier today, and that is that there are multiple data sets out there, in this case, that provide information on daily mean PM2.5. What you're looking at here is an average across New York State. And for health studies, the question is, which one should I choose? And which one is best? And so I have a co-I on my team at Columbia had, under a different project, developed a statistical framework for bringing together different data sets and coming up with a best estimate, and importantly, an estimate of uncertainty. So the best estimate is shown in black. The gray is the uncertainty. This particular application is a HAQAST application because with our New York State Department of Health collaborator, Temi, who is going to speak next, we were able to use the existing framework, but also through discussions with this community, build a more user-friendly tool that is now publicly available for anyone who wants to take different data sets and bring them together in this way. Okay, let me pass over to Temi.
Thank you very much. All right. New York State Department of Health as stakeholders has benefited a lot from NASA products, particularly having access to satellite data for air pollution as well as temperature. So we seek highly resolved, multi-pollutant and heat exposure data set to incorporate into our public warning systems as well as for health research. We want to know how pollutants and their uncertainties differ across rural-urban gradients. We also want to know perform exposure response functions and do our health analysis with this. So how does the BNE, sorry. All right, so we want to know, okay, how would the BNE framework that Arlene just talked about be useful for us. So the DNER framework incorporates different data sources into the tool, and we get the best estimates. So I'm using PM 2.5 as an example here. We want to apply this best estimate derived from the tool to map out PM 2.5 exposures across the state. We want to see how this differ across rural-urban gradients. In the previous slide, there was a map there that showed the different monitors across the state. If you looked carefully, you would have seen that a lot of counties did not have monitors, and those are rural counties. So having this tool and having the best estimates data set allows us to have data set all across the state. So having this is pretty useful, and I want to say thank HAQAST for this. Another useful resource we got from the collaboration with the Fiore team was to get a derivative heat exposure data set, the 4x4 kilometer gridded, daily maximum temp, and heat index. So we have, out of some of the resources we have is daily maximum heat index, approximated daily maximum shaded bulb globe temperatures, as well as area level averages across the state at the census tract level, as well as the county level for 1981 through 2023. Please note this data set is available for the Contaminants US, so if anybody's interested in that, we can get you access to that. We also have another data set that contains the number of heat waves across the state during this time period at different thresholds for 85, 90, 95, and 100. So this is some of the tools and resources we've gotten from a collaboration with this team, and I'm going to pass it over now to Arlene to talk more about some of the other deliverables that we got.
Okay, so I'm not going to really say anything other than we put this slide up because there was a lot more work that we couldn't talk about, and I did want to call attention to some of the deliverables coming out of one of these cross-team collaborative activities that is focused on supporting tempo applications for surface ozone.
And hopefully at the end of this session, we will bring all of our folks back up on stage for some Q&A. So we're going to move now on to the next talk by Bryan Duncan of NASA Goddard Space Flight Center. His stakeholder, Kellen Namusisi, the African Center for Clean Air, was unable to be here, I believe, today. I was told that by Jenny. Yeah, she was unable to be here today, so it's going to be all on you, Bryan. But Bryan is more than capable of handling this talk. Bryan has been a part of from HAQAST to HAQAST since its very start, one of our foremost air quality satellite data experts at NASA Goddard Space Flight Center. So I'll turn it over to you, Bryan.
Okay, so let me just give a quick overview of who's on the team. Kevin Cromar at NYU, he's a health professional in the back. Anna Prados, she's at UMBC. She is also with NASA, so she has decades of experience working with stakeholders, and she's also an expert in air quality. And then we have two other contributors. Oh, okay. So we have other contributors, Sarah Lazarek and Kellen Namusisi, who couldn't be here today. They're both at NYU. Okay, so I'll just present her slides. Okay, so our project methodology is outlined in our paper here in GeoHealth. And by the way, I'm going very quickly, and I'm assuming these slides will be made available online so you can go back and look for references. But the project methodology is pretty simple. We're going to build on all the work that we've done over the last 15 years with HAQAST, HAQAST 1, and HAQAST 2. Add to that diversity by adding in some new stakeholders, find out what they need, and then identify ways to scale up engagement. How can we broaden use of satellite data based on the experience we have with these individual stakeholders? And the idea is fairly simple. So we talk to stakeholders, hear what they want, what they need, and then try to integrate NASA satellite data and NASA air quality forecasts and whatever into their standard, their decision making. And the idea is to integrate it with their air quality observations, whether it's monitors or low-cost sensors. And then also we have a portion of our project with communication. Okay, so we have three different sets of stakeholders here. I grouped them by Rio de Janeiro and Quito, La Paz, and Santa Cruz, Bolivia. and the other is the African Center for Clean Air. So let me take a step back. So HAQAST focuses on U.S. Stakeholders, both private and public stakeholders. So why are we talking about these international stakeholders? Well, there's a couple of projects that HAQAST will fund on international stakeholders. But there's a lot of, let me just point out the benefits. There's so many benefits, and I only list a few here, working with these stakeholders. One is to provide NASA and also the stakeholder data to U.S. interests abroad. For instance, we've worked with the U.S. Army Public Health Center, some U.S. embassies with the State Department, and there's also private companies. And of course, the most obvious is, well, there are many U.S. citizens living abroad, and they're experiencing high levels of air pollution. So it's good to work with the local stakeholders to help decrease air pollution. And then this is something you probably don't think about is there's a NASA perspective to this from the cost savings. And I'll give an example of that, of how we get access to their data sets for validation of satellite data. And in our case, we actually have a couple of stakeholders who are helping to maintain some NASA instrumentation. Okay, so let me go to the first group, Rio de Janeiro and Quito. They have Felipe Mandarino as our contact at Rio. They have more resources than most of these Latin American countries. Valeria Diaz, they have very limited resources at Quito. And the first thing that they wanted us to show was, well, we have these new air quality networks in our cities. Basically, they wanted to know if the data were any good. And fortunately, Kevin and his team were able to work with them and do health analyses to show that, yeah, they're making pretty good sense. So it's a good indicator that the data sets are robust. And one of the things Kevin and his team found is that NO2 is the strongest indicator of respiratory morbidity in these cities, which is different than in the U.S. And that's fantastic for us because we can measure NO2 quite well from space. Okay, so Bolivia. They were most interested in smoke monitoring and alerts. And if you look down here on the bottom, that shows a picture of Bolivia. You can see La Paz and Santa Cruz there. And they have this just horrible seasonal agricultural burning, and it's getting worse in the last few years. So it's in like the October or November timeframe, and it can go on for months. And so Ana Prados has been working with them and the media in in Bolivia, to get the word out about air quality and the availability of NASA resources. For instance, some of you maybe remember the UMBC smog blog from a few years back. They set up one in Bolivia. And also, Anna was able to talk to the media there. And fortunately, Amy Huff at NOAA delivered a whole series of advanced satellite data trainings for the stakeholders there. And one thing that was interesting is that you see Santa Cruz is there, and La Paz is sort of in a cleaner area on this day. But the U.S. Embassy said, well, the air quality in La Paz or Santa Cruz is so bad that we want to put up our own air quality station. And they asked us for help. You know, can NASA help us? So I talked to the NASA Pandora project, which measures NO2, ozone, and formaldehyde. And they were able to put together an instrument for them from spare parts that they had left over. And then Marcos Andrade, who is one of our stakeholders there, actually helped calibrate it and install it, and he's bringing the embassy staff up to speed on how to maintain it. So there's a wonderful synergy there that saves NASA money. Okay. Scaling up. So the idea is very simple. If you want to just build capacity with stakeholders, you're going to reach fewer stakeholders than if you also develop, in NASA speak, what we call level 4 data products, or these ready-made health and air quality data products that are out of the box that stakeholders can use for their applications. And the idea is you not only broaden the use, but you also broaden the use to novice stakeholders as well as intermediate. And as you know, many health and air quality stakeholders fall in the novice category. So we have a website, and we put on a number of HAQAST produced air quality and health data products onto this site. And this is at the NASA guest disk. And just search for the word HAQAST. And Nucera, who's back there, Nucera Lazrak, has been working with each of the data producers to develop what we're calling a fact sheet. And it's really a wonderful resource. It gives you an idea of what you can use that particular data set for, what you shouldn't be using it for, how to download the data, who to contact, and then points to a number of resources. It's really wonderful. Okay, I think we're short on time, so I'll skip over this, but we're trying to cobble together funds to continue to work with some of our stakeholders. And since Kellen's not here, I'll just talk to her slide. So the African Center for Clean Air is this consortium of African nations where you have a bunch of people trying to get together to develop and coordinate efforts among these health and air quality stakeholders. And Kellen and Gabrielle were the co-leads of that. They're the co-leads of this. And so we worked with them just to show the different data sets that we had that could potentially be useful for them. And so hopefully we can continue to work with them and go forward. But one of their major issues are characterizing urban air pollution and then smoke monitoring and alerts. Okay, so lessons learned. And I was hoping Kellen would be here because I wanted her to give this from her perspective with the African Center for Clean Air, but I'll just give it from my perspective. So the bottom line is building relationships with these governmental stakeholders, it just takes time. It takes funding. It's more than one HAQAST cycle sometimes. And we're finding that out. It just takes years. And we also found out that local academics, for instance, in the case of Bolivia, and NGOs facilitate these relationships. For instance, Karen and Marcos in Bolivia have the ear of the federal government there. These out-of-the-box health and air quality data products are wonderful for these for people who in the U.S. as well as abroad who don't have resources, and stakeholders are often interested in health analysis, which we were able to provide. Opportunities. There are many smart and talented scientists out there, but most of them are just resource starved, and so these out-of-the-box air quality data sets are wonderful for them. So I think that's it. I'll just end there. Okay.
Thanks so much, Bryan. And next up, we will be hearing from Daniel Tong of George Mason University and Michael Geigert of the Connecticut Department of Energy and Environmental Protection. Daniel Tong is our dust guru, I would say. Everything dust goes to him. And in fact, I will just mention, because he's probably too humble to mention it, that thanks to his work in assimilating NASA satellite data into the NOAA National Air Quality Forecasting capability, he received a commendation and citation from the Associate Administrator of NOAA. So yes, give him a hand for that. And Michael Geigert, we say super user, ambassador. He was the OG super user, okay? And he has been with us over many, many years and just been such an advocate, such a user, such a champion for our program. So I really appreciate that. And I also hate to announce he's going to retire later this year. And I know he's going to be having fun with his blueberry farm and all that, but it's going to be big shoes to fill, Michael, and well-deserved retirement, but going to miss you. So I'll turn it over to Dick.
Hi, good morning, everyone. It's really such a privilege to be part of HAQAST and having this opportunity to work with this wonderful community. I just showcase a few things our team has been doing to proving the extreme event forecasting and also how to raise the public awareness about those hazards. So Jeff already explained it much better than I can do. I guess I just go to a question. So if I'm a forecaster and user, what product should I use? Right, so with the help from our graduate students, L. Macaron, and then also former research scientist Yunyao Li, who is an assistant professor right now at the University of Texas, Arlington, we developed this ensemble forecasting system. Basically, the idea is to pull all the forecasters from our federal agencies, from NASA, from NOAA, from the military, and then we combine that, come up with this ensemble forecasting, which can be shown to outperform individual forecasts. And with that, we also develop a customized product so that to suit the different end users. Then along that, we use a bunch of NASA satellite data and then also the geospatial forecast. So Yunyao right now got actually a new project. She's leading this next chapter of this HAQAST project, trying to support the WMO, North American Fire Center, and also working with private insurance company, Kaiser Permanente, to deliver the data directly to the patient. So John already mentioned I'm a big fan of why it's moving so fast. So big fan of dust. So compared to fires, dust gets much less love. So I'd like to shed more light on that. So if I ask you how many people are killed by dust storm every year in the United States, you may think that's probably zero, right? This is actually what is coming from the official national hazard statistics. That's a zero. But it can have one dust storm kill multiple people. So these numbers do not add up. The slide's got its own thinking. Right. So to debunk these myths, we work with several agencies using NASA satellite data to validate the police accident reports. We come up with a more complete data set, which is showing that we actually dust storm killed 20 times more people every year than previously known. So where did this happen? Can be anywhere in the country. You can see the hotspots in the desert area, outside the desert regions, and that's mostly cropland and rangelands. So basically, you can have a dust storm anywhere in the country. You are not immune to that. And that's, so for example, this is the one dust storm in the central Washington state, and that's nicely captured by NASA's MODIS satellite center. So how much does the cost our society or economy? We just have a paper accepted this week. Last week came up with this total economic cost of $154 billion. That's because that's not only a transportation safety threat, but it also impacts our health, impacts agricultural food security, and also energy productivity. So majority of this impact is for the health impacts, almost 60% of it. Compared to the other billion-dollar disasters, dust is ranked number 2. It's actually beyond wildfires just after the tropical cyclones in most years. But of course, we got a new number this year. It's got a way to see. Right, John already mentioned this. Actually, I borrowed this slide from John. We are working with the National Air Quality Forecasting Capability Program, which is a partnership between NOAA and the EPA, trying to supply real-time forecasting guidance to the states. Michael is going to talk about that. So we developed a different method, trying to use NASA satellite data to improve data forecasting. Thanks to Barry Baker of NOAA, we have implemented it in the operational forecasting system since 2021. So last, I'm going to cover about the work we are doing with public outreach and the community building. We are mostly collaborating with 2 large groups, and the first one is DANA. DANA is the Dust Alliance for North America. It started, so HAQAST helped co-founded DANA, and we have been supporting this, and now it's growing into an organization with more than 600 people. Scott has a slide talk about it. Please go check it out. We are also working with United Nations. We're promoting data awareness through the International Data Day, which is July 12. And I also been helping them to chair the WMO data program. Yeah, with that, I'm going to yield the mic to our star stakeholder, Michael Geigert.
Yeah, I'll try to handle this pointer. It seems to have a mind of its own, doesn't it? But thank you, HAQAST, for having me here since 2017, I believe, and be able to speak at every one I've been invited to. So anyway, it's exciting. I'm going to do a different perspective on the stakeholder because I had a unique opportunity this year to present. Now, usually when you think of public outreach, you get the message out. We have a way of doing it in our department. We send out press releases or we answer press inquiries. And so I had this unique opportunity. Our commissioner wanted to do a deep innovation fair, and he invited a bunch of work groups to show what they do. So we presented posters. I was invited. You see me. The governor was invited. It was public. They had a bunch of people that they invited, let's say. And then there's Katie Dykes, our commissioner, and I have a fairly good relationship with her, with air quality, communicating with her. And there I am in the corner. And so that was exciting. Now, what I'm presenting here are videos from the interview. She interviewed me. And we shall see if they work. Well, first of all, here's the poster. This is the poster. And so my job was to tell the commissioner how we use satellite data for air quality. And there you go. So I did a mix of events. Smoke is sort of the big thing, for sure. Ozone's the major problem for NAAQS attainment, for Connecticut. People don't really notice ozone, but they notice smoke. So everyone knows about the June 2023 Quebec fires, and I put a little wind bag up there to accentuate. I thought that was pretty good. And then we worked with NOAA with aerosol optical depth. So we use every satellite product that we can to get the message out. Now we have Tempo. I did an illustration of a day with Tempo. So let's see if this works. If this works, then the animations will go ahead.
So one of the challenges that we face here in Connecticut is air quality. We know we have high levels of asthma and respiratory illness because of air pollution that's coming from industrial sources, power plants, and traffic, from gas-powered vehicles here in Connecticut, but also a lot of pollution that's impacting Connecticut is coming from states to the west of us, right? Because of weather patterns pulling that in. So tell us.
And next, I put these in segments, and
so before we had this tool that you're going to talk about, how would we track the air pollution coming into Connecticut?
We basically have a monitoring system throughout the state that EPA mandates, and we just watch the monitored levels. But in the past, the satellites weren't quite as sophisticated. We'd be able to look at visible satellite. We could see smoke, for instance. But now we have a new tool with NO2, and we can track pollution from combustion sources. The new satellite called Tempo takes hourly scans of our area, and we can watch the evolution of NO2 from New York City as it passes over Connecticut.
All right, tell us what NO2.
okay, so I told her about
But
And NO2 contributes to forming ozone, and we know ozone is what really makes it hard to breathe if you have respiratory illness like asthma, right?
that is correct. Ozone is still a problem for Connecticut because we're downwind from New York City. Now, particulates are also an issue. PM 2.5 are fine particulates, and we had that problem on 2023 in June from the Canadian wildfires from Quebec. And on this poster, I show where the fires started from lightning, and the weather pattern was such that it was blown south right over us, and we had the worst air quality ever reported in Connecticut.
I know at that time the public had a lot of questions. They saw that the sky just looked different. It was turning orange, and people wanted to know what was going on. And you were there behind the scenes with this data, helping us communicate about what we were seeing.
Yes, we issued air quality alerts to the public as part of our job, and we were right on top of this, giving you every morning the update on this. So,
one more segment. You don't want to miss this.
I know that when we are able to have that information really quickly, then we can help people be prepared for the day that they may want to stay inside, not go out and go for that run, and that they can take action to try to minimize their exposure, right? Which is really important for folks who have respiratory illness. Well, it's amazing. Most people, are impacted by this, but they don't know a lot about what we do here at DEEP to help measure and keep track of this pollution. And I know I'm passionate, I know you are too, about helping people breathe easier and helping to protect people who have those respiratory illnesses, and it affects a lot of kids and families. So it's extraordinary, the technology and the science that goes behind helping to do that.
Yes, we are doing our part to protect public health.
Perfect. Thank you, Michael. Appreciate what you're doing.
Thank you. And thank you, HAQAST. Yeah, that was great. Great commissioner. And I have a very good relationship with her. So there we go. And move back.
Thank you. That was awesome. You're also done. Okay. So again, hopefully have the opportunity here some time at the end for some Q&As with all of our presenters. Our final presenter is Dr. Qian of the University of Texas Health Sciences Center at Houston. Her stakeholder is Kelly Crawford, a U.S. Department of Energy, but Kelly cannot be here today. But Dr. Xiao will certainly admirably handle, I'm sure, all the slides. I just want to say that Tracy mentioned earlier about when we went from HAQAST with the A to HAQAST, it really opened up a lot more possibilities and new opportunities for us to see how we could utilize NASA's satellite data for societal benefit, things that we had never even thought about before. And one of those was Dr. Zhao's work on artificial light at night and the health effects for that. Before her project came along, nothing that we had ever done in that area before, and it has just been absolutely fascinating. And I also want to thank her. She hosted the first HAQAST meeting that we had in person when the pandemic was coming to a close. So we really want to thank her. Had a wonderful time in Houston, and thank you. We had a lot of challenges putting that together, as you can imagine, coming out of the pandemic, but it went swimmingly. So thank you, Dr. Xiao, and I'll turn it over to you.
All right. Hello, everyone. It's a great honor and pleasure to be here. And I still remember that first HAQAST meeting that I attended, and it's hard to believe that was 4 years ago. I'm certainly one of those people whose career has been impacted very positively by HAQAST, which has broadened my horizon in my research and has also changed my career trajectory in many positive ways. So it's really a pleasure to be here and share with you some of the work that we have done in the past 4 years. And as John have already mentioned, our work centered around artificial light at night, or light pollution, as an emerging environmental hazard and public health threat. So the nightscape of the modern world has been forever changed by the invention of electric lighting. And there's no doubt that electric lighting has tremendous values and benefits. However, it also comes with unintended consequences. Specifically, there are economic consequences, ecological consequences, and public health consequences. And since I'm a public health researcher, I want to highlight a number of diseases and health conditions that have been linked with light pollution in health research. And those include sleep deficiencies and disrupted 24-hour circadian rhythms. There are metabolic conditions, including obesity and type 2 diabetes, cardiovascular disease, various types of cancer, specifically breast cancer, and also thyroid cancer, pancreatic cancer, and prostate cancer have also been implicated in literature. And finally, you get mental health problems and cognitive decline. So light pollution really impacts a large variety of health conditions. So 4 years ago, when we joined the HAQAST team, those are our plan or study objectives of our team. We proposed to construct light at night maps for the purpose of identifying hotspots. and those are neighborhoods with the highest burden or exposure levels of light at night, as well as neighborhoods that has experienced the most rapid increase in light pollution levels. We're also dedicated to promote the public access to light at night data. So we mapped the data at administrative levels, such as county and census tracts, and we share those data with various data platforms by NASA and the CDC. And the reason we did that is that many of the health data are reported at those levels. And we also developed a dashboard for visualization and analysis of light at night. And we believe our project or our team has a number of positive impacts, including expanding the scientific knowledge about light at night and associated with health outcomes. The information can guide policy design and public health interventions, increase public awareness and knowledge, and benefit those neighborhoods with high exposure levels. So a quick overview of some of the work we did. This is an example that we characterized the spatial temporal patterns of light at night using NASA's Black Marble data suite, and that's coming from the VIIRS data, satellite data. And on the right side, you have the spatial distribution, so that's just average level of light at night across the U.S., and the little pixels represent counties. And on the left side, you have temporal trend, where it's the change of light at night. And when you focus on the right side, you really see your usual suspects. Those large metropolitan areas really light up with the darker colors indicating higher levels of light pollution. And if you focus on the left side, first you would see that many counties in the western and other areas in the middle of the country actually experienced a decline in light pollution. However, there are definitely hot spots, as indicated by the warmer colors. And one interesting finding that came out from this analysis was that when we ranked all the counties by how rapidly light at night increased over that period, all the top 10 counties are in my home state of Texas. And we dug a little deeper and realized that those are rural counties that experience a lot of oil and gas drilling activities. So undoubtedly, those industrial activities have contributed to the rapid increase of light pollution in those areas. Of course, the future step for us is to determine how and whether that is related to health outcomes. And all those data, those are county level, but we also have census tract level data, and we have shared them with data platforms, as I mentioned before. We also developed a dashboard to increase the access to light at night data, and this is a screenshot of the dashboard that we developed. And you can select different states, and we selected Texas here. If you hover your cursor around one of the counties, it gives you basic statistics, the trend, and some other information. And one thing I should mention is we're really trying to improve this platform by adding in other data. And as I will quickly talk about in the next slide, that we're also going to develop this dashboard into sort of a toolkit so that community members or even kids, students can use for analyzing satellite data and maybe do some, citizen science projects. Which comes to the last slide about various community engagement activities that we have done or planning to do. And we have worked on some analysis to identify communities with high burdens of light at night. And this is in addition to the slides that I just showed you, which showed geographic variations. So for this project, we really focused on different attributes of the neighborhood, social demographic factors, lifestyle factors, and really trying to characterize neighborhoods and trying to understand who they are and who are those people that are experiencing light pollution and maybe coexisting factors that may lead to even higher health risk in those communities. And we have engaged in a number of public education and community action activities that focused on light pollution and its consequences in Houston and Chicago neighborhoods. We have joined the night walks and gave public talks, which generated a lot of interest about light pollution and health outcomes. Again, develop dashboard into data visualization and analysis, something we're planning to do in collaboration with, many of our stakeholders. And we are working with high schools and after-school programs to develop curriculum that focus on light pollution to educate the kids. And we are also organizing community events focusing on the health consequences of light pollution. More recently, I started to work with some public health departments in Houston and in other areas of Texas. And we are conducting health assessment related to environmental hazards, including light pollution. And in a more recent discussion, we're thinking about using light at night data to study things like power outage after disasters to really assess which are the neighborhoods that are most impacted by those disasters. So I think that's all I have today. And I just want to thank you, all the other HAQAST, the PIs and my co-Is and students and postdocs that have worked with, and thank NASA for providing this wonderful opportunity.
I would like to invite all of our speakers to come up and take a seat, either on the left or right side of the stage. We have stairs on both sides. And as they're gathering up, if you have any questions, we have Jenny and other people out there to pass the microphone around. Up there in the back.
This is a question for Daniel. For the research on dust, and have you or anyone you've worked with looked at dust from tailings, like either old ones or from active mines in the U.S. or elsewhere?
Question. We are mostly working on wind balloon dust. However, we noticed that's also a big contribution. 80% of the PM emission from the U.S. is from anthropogenic dust. So this is another project we are working on, which I did not have time to cover. It's called North America Chemical Reanalysis. So we are running the model with the EPA emission inventory for 20 years. From 2003 to nowadays, and that work probably find some answers. But I can tell you that stone has not been turned for past 30 or 40 years on anthropogenic emission inventories. So there's a lot of uncertainty. Data are completely outdated. So that's something that we hope to work with the EPA in the coming years.
I was going to say we have a question online from Ariane Moore for Arlene and Timmy. Is the B&E tool available for users to input their own different exposure data sets? And if so, does the user need to already know the uncertainty of the individual data set, or does the tool provide the overall uncertainty of the final modeled concentration based on how different the input exposures are?
Okay, that's a great question. Thank you, because I didn't say anything about how this works. So there is a paper that was just accepted, and along with that is a GitHub where the code for this BNER workflow is. And so I think a short answer might be yes, and get in touch with us. But the idea is that the way this tool works, so for instance, we'll just take PM 2.5 as an example. You have the input data sets. You do need to get them. The tool helps you get them all into a standardized format. And then the statistical methods are basically doing a weighting of each individual input data set against the kind of gold standard PM 2.5 air monitors in the U.S. This is U.S. for now. It would be awesome to take it global, but it's just U.S. for now. And then from there, the tool itself generates the best estimate and the uncertainty. And we could talk longer about sort of what exactly that uncertainty means, but hopefully that helps give some outline, and I'm happy to follow up offline.
Hey, thank you guys so much. Those were really great talks. Bryan, Duncan, I think this question is mostly for you. I love your data fact sheets, and I especially love that they have the data limitations on there. But can you talk a little bit about what goes into how you're coming up with those data limitations, which might be not be very much since it's just a bullet or two?
Okay, well, I wish Nusair would take the mic back here. He's the one that's been working with the individual data product developers to come up with these use cases, these limitations. But most of the time, you can just look through the literature and figure out what you can and can't do, you know, what people are doing and what their limitations are by actually looking at the scientific papers that are using these types of data sets. But it just comes from experience. You know, I've been working with these data sets for decades now, like Arlene and Michael. So, you know, a lot of this just comes from our own experience as well.
Well, thank you, everyone, for excellent talks. And since the theme is increasing public engagement with NASA data, you know, we've heard a lot about what NASA has been doing to kind of incentivize this. Are there lessons from some of your own experiences or just thoughts about how other organizations like health departments and environmental departments or nonprofits or companies could be keeping this ball moving and accelerate the change even beyond HAQAST and other NASA activities?
I guess I could chip in there a little bit. I guess having access to the NASA data, HAQAST data, and just the collaboration with the PIs and all the other co-Is has been very useful for us. And I encourage any community organizations as well as public health organizations out there to do look into, how to get access to the data. I know there are RSEP trainings. That's how I got involved, and then having my supervisor, who is also a former PI on the HAQAST grant, get me involved. And we've been encouraging other bureaus within the department to also use NASA data for their activities. So I know a bunch of websites have been shown where you can just Google HAQAST and you can get a lot of data. It's pretty easy to use once you get a hang of it. And there are trainings online for community members as well as organizations and public health agencies to learn more about how to use the data and download the data.
Yes, Michael Geigert, Connecticut. I just wanted to do a thing about the smoke we had, of course, in June 2023, because the public gets their information from the media. We might get a few calls to our department, but they're watching the media, usually network TV or whatever, and they're seeing, I think, the EPA fire and smoke map and HER smoke, besides the satellite. I mean, the weather forecasters on TV will show these and such. So that's been very helpful. I mean, that's really the end product that they're seeing. I mean, they don't really know where it comes from. We know that the models like HER smoke has some limitations, not always 100% correct. And we know that our air quality monitors aren't 100% correct in smoke because our 640 particulate monitors overestimate smoke. So, it'll show code purple, looks like sudden doom for humanity during that event. But it was still good. I mean, it did warn the public. I just wanted to note that's what the public is seeing. I do the analysis using the NASA NOAA products, and I get a better idea. It definitely helps in my forecasting. But if you really want to look at the public, yeah, it's the media that really matters.
Hey there. So I have a question because it's so good to see, this brilliant minds at work, but there's a younger generation out there that are thirsty for knowledge, and a lot of it is out on social media. And I am thinking, do you guys have a way of communicating what you're doing more
openly. So, for example, he was talking about, in reality, kids nowadays, and it happened to me for New Year's, I was like sitting right behind two teenagers. They had EPA's earnout on their app, and they were looking at the contamination and the levels rising while we were doing the fireworks. And you would think, wow, I use that on my daily, work. But these kids are actually, getting a hand of that kind of information just to see what's going on. Have there been any efforts on, getting this out? Just like there's so many stuff they have no value, they're going out on social media for these people to go dumb. Can we make them smarter? Do you guys have any tools that we can, provide?
I just have a simple comment. I don't tweet, so I leave that to other people in our projects. But as one example, when we were working with people in Bolivia, raising awareness was the big issue. It was just absolutely the biggest issue. So how do you reach people? So Anna Prado started working with the local academics there, and they came up with this smog blog idea. It was like it worked in the U.S. There was a lot of engagement with that. So they have now one in Bolivia and Peru. And so they're sharing particular events, through whatever various different social media platforms. And it gets noticed and it gets forwarded around. So that's one way that has worked, at least in Bolivia, and I'm sure that would work in other places as well.
And we have a comment from Kellen, who is online, who said regarding public engagement, after the webinar facilitated by the HAQAST Tiger team in Uganda, several local universities gained interest in NASA data, and they want to get more training for their students.
I wanted to make a quick comment and then tee up Bryan to respond. Something that was really surprising and rewarding with the international work we weren't expecting is even though there's fewer U.S. citizens in these cities, air quality is most U.S. citizens' #1 issue they worry about when they have to go live abroad. They worry about where their kids go to school, and they worry about the air quality. It comes up all the time. So even though there's fewer U.S. citizens there, it really is their #1 issue they worry about. So it's kind of this really interesting weighting, and it was really tremendously valuable to experience that. I don't know if Bryan has any follow-up comment on that.
Yeah, I'll just confirm that. I've traveled to a number of different countries, such as Indonesia, and every foreigner I meet there, and even people who live in the cities, talk about air pollution as their #1 issue. I remember we had, I see Melanie over there, we had a State Department event where we talked to, I don't know how many people there were at that event, but they were very passionate about air pollution, and these were actually Indonesian school children, and they were, or I would say high schoolers, and they were very passionate about air pollution. So, yeah.
I was just maybe going to circle back to the U.S. as well and just kind of go back to Barron's talk and the bringing in additional data sets from including satellite data into things like AirNow, that it sounds like it's actually really exciting to hear that you're seeing teenagers actually checking it out and, and getting excited about it. And so maybe that's just a note for all of us that as we're kind of building new tools and web platforms and kind of this public outreach, maybe also just having a little bit like want to know more that's like a little more obvious up front so they can, I mean, it doesn't have to be kids, but whoever can click and like if they want to say like, how confident are we in this? What are the uncertainties? Where's this data coming from? Who's doing this? Anyways, just a thought.
We have another online question for Bryan. Mark Forshak says, I was interested in your mention of private companies' interest in data. What sort of data are they interested in, and towards what goal might they be using it?
Yeah, I actually, when I wrote that, I was speaking more broadly about all types of NASA satellite data sets, whether it's like Landsat data from, from NOAA, USGS, or NASA. I was speaking very broadly. But there are many of these private companies, they have U.S. personnel there, and they're interested, as Kevin was saying, in the air quality. They want to know before they take a job in a certain city, how bad is the air pollution? What will my children be exposed to? So it's the same type of issue.
We have time for one more question if we have one more.
Hi, I work with the health department in Colorado. I have a question for any one of you. If you've seen any examples or results from your studies, from your research, is there any policy changes, system changes, or behavioral changes?
Yeah. Well, a lot of my work are technical, but behind that, people take it to the next step. For example, our ensemble forecast right now in Yaoni is taking it to a next mile, trying to work with the privates, and that's going to change the insurance policy. That's a kind of policy. And on the international level, we are pushing a lot of things, coordinated with WMO and also with the community, right? So that's our strategy. Is not, we are not directly involved. We're trying to be an objective data broker, provide the satellite data, provide model data, interpret it in a way that people can use to support their decision making. That makes sense.
All right. Well, let's give another round of applause for our speakers.